Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco.
Today, we're going to talk about abdomen or waist liposuction. Liposuction is essentially a coined term using a medical procedure to remove fats from the body. However, liposuction on the waist and abdomen involves much more than that. Essentially, to get a good result from liposuction, you need to achieve a few objectives. First of all, reduction of fat layers. Secondly, contouring and shaping of your body shape portion. And thirdly, tightening of the skin. So a good doctor with good liposuction skills should be able to achieve all of this. Let's talk about contouring and shaping of abdomen and waist. Imagine just having your fats removed from the abdomen or your waist without any proper shaping or contouring. You're just going to have a slimmer and smaller waist and abdomen without any shape, contour, or proper lines. That wouldn't look natural, nor it would be nice. However, if you can shape your body by reducing fat and producing a more natural proportion with visible musculature lines and curvature, then the results will be more optimal. During consultation, it's very important for me to understand what the patient's expectations are like, and also to assess in detail the patient's body shape, contour, and height as well. For example, for a patient who has a straight, flat body without too much significant curves, the objective for me is actually to carve out a body contour and proportion which is more curvy and soft and make the patient look more feminine. On the other hand, if the patient has a very curved, round body, then, of course, depending on the patient's preference, the job is to create a more tone to enhance the hip-waist ratio, but not to exaggerate it. To achieve the objective, the approach of liposuction is not only to treat the abdomen, but also the waist and the lower back, mid-back as well. So the process starts by assessing where the fats are, the distribution of fat, how thick it is, the skin quality, the anatomy of the muscle, the hip and size proportion, and so on. So during surgery, fats will be removed not only to flatten and reduce the layers of fat and reduce circumference, but also to highlight the musculature and also to create the curves and proportion according to what was planned before. The areas will involve from the front, upper and lower abdomen, go to the sides, the flanks, the lower back, up to the mid-back portion. It's what we call a 360 liposuction of the mid portion. So in short, during planning, after we discuss with the patient and talk about what we can achieve and what the patient will prefer, we start by drawing on the body by marking out the landmarks, like the location of the ribs, where the abs muscles are, and then the hip bone, the contour of the hip bones, and of course, to isolate and to feel for the outer border of the buttocks and the lower back as well. So with all this in place, I can start to feel that which are the areas where the fat should be taken more, and which are the lines and shapes where we need to highlight, and so on and so forth. Kind of like envision what the end results will be like, and that's where the liposuction will start. And fats will be taken out, and contours and lines will be highlighted. After that, skin will be tightened at the same time. And very often after the surgery, patient will see the outline of the shape and the size. But of course, there'll be swelling for a while. When the swelling resolves, and then we can start to see what we plan to achieve. And very often, if everything goes well, then we should be able to achieve a kind of like a proportion shapely body which is suitable to the size and height of the patient. And with that, if the results are good and surgery is successful, it should look natural. There shouldn't be any trace of surgery or liposuction when others looking at it. Well, over the years, I've seen many patients come in for consultations for botched liposuction, where after liposuction, either the contour is irregular, the shape is awkward, or it's not natural. It often is something that affects the patients adversely, and they're usually very miserable about. So the objective of doing correction liposuction for patients who are affected by adverse results is that we try to undo the mistakes that's been made and make it better than before. So, for example, patients who suffer from dense or oversuction, then the job is to take fats out for grafting to the areas. For lumps and bumps that's been left behind, we do correct and flatten it. And of course, for patients who suffer from uneven contours, then is for it to even out and to shape it, to correct it, to make it a bit more whole and natural for them. It's hard work. The surgery usually is harder and more complicated than for patients who haven't had any surgery before. One of the most common questions that I often hear from my patient is how many inches can liposuction take off from your waist and abdomen? Well, it depends. It depends on where your fat is distributed, how thick it is, and your body shapes. So, for example, for those who have very curvy hourglass figure with high hip to waist ratio, then more fats can be removed on those waist area compared to the hip. And with that, patients may find that more inches can be taken off. And on the other hand, patients who have a straighter, more toned body with a lesser hip to waist ratio, the fats are more evenly distributed. So a liposuction can take out a substantial amount of fat without having shaved off too much of the inches from the waist and abdomen. So it depends on lots of factors. Post liposuction, there are a few things that a patient can do to help to improve their results and their recovery. One of them is to have compression on the treated area. Compression garment is one of those things that we advise patients to wear it post-operatively for a few weeks up to a few months. It helps to compress the space, reduce swelling, and help to contour, allow the skin to tighten more evenly. So patients are usually advised to wear it as much as they can for several weeks up to a few months, depending on how much swelling and how much loose skin they have. So why do people find small waist and abdomen attractive? Well, I think it's, first of all, it depends on many factors. One is culturally. Most people believe that small waist indicates health, beauty, and vitality, fitness as well. For those patients who doesn't have hourglass figure or high hip to waist ratio, they may not appear to have a small waist based on their body shape or proportion. So some of the controversial things that patients, doctors do is to have the lowest ribs removed to create a more curvy and more hourglass waist for them. As you know, removing of ribs is actually a very controversial procedure. It has its own risks and complications. And the results sometimes may not look natural and may not look good or may not suit the patients in many cases as well. The other thing about waist trainers that we often see and hear people's wearing, it's actually a temporary results, but there are dangers of wearing it constantly. Waist trainers such as corsets, girdles, and shapewears may cause detrimental effects, breathing difficulties, organ damage, and weakening of core muscles, even affecting appetite as well. So yeah, it is not something that can permanently change or shape your waist.
Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them. See you again.